pharmacy. So, sir, let me welcome and share some moments from your valuable program today, and please guide us for our future life. Thank you.
Thank you very much. I will start because the time schedule is given me for the 1 hour. So I will try my best to finish my presentations within that week. Thank you very much for inviting your auspicious programs on the day of World Pharmacy Day. So I am starting my presentation. Right.
Sure. Problem আছে কিছু?
Hello.
Hello, sir. Please start, sir.
Is it visible?
বলবেন। কিছু বলবেন।
Is it visible?
Yes, sir. Yes, sir.
Okay. Before starting of this, I must convey my gratitude for the college, the PG Institute of Medical Science, and the chairman, Dr. Prabhas Ghosh, Society Kapsi Abhinandan Sangha, and principals of Engineering Department, Karunamaya Bhattacharya, Principal PGI MS, Dr. Biplab Kumar Chakraborty Chakro, Associate Professor OIC Niranjan Adhikari, and TPO Mr. Tapon Chakraborty, and all the students, my favorite students, the faculty, other faculty members, and others. I am starting my very important topic today, that is known as ADRs and pharmacovigilance. Are you ready to listen me?
Yes, sir. Please continue.
Okay.
Yes, sir.
Okay. So ADRs and pharmacovigilance, this is a very important topic of pharmacy, and all the pharmacy students should go through this one, because the most of the day you are taking the drug, or your family members are taking the drug, so they are facing some problems with the adverse drug reactions. So there may be some vigilance between that things, that is the taking of the drugs and the adverse drug reactions reporting system. So I will discuss in short all about that. Some ADR I have shown here, that is the pictures of ADR due to the drug. The drugs are always taken as benefit of the human body, but sometimes they cause some adverse effect. Why they are causing the adverse effect, and not that I will discuss one by one. Now, the first thing you have to know, the definition of the pharmacovigilance. What is pharmacovigilance? Pharmacovigilance is a branch of pharmacological science relating to the detection, assessment, understanding, and obviously the prevention of the adverse effect, particularly long-term and short-term side effects of the medicine. This is very important. What is detection? If you have taken some drugs, like very simple drugs, that is aspirin, and you have detected that some itching sensations or redness of the skin, that is the detection. And assessment means where it has been spreaded, means all the body or the part of the body, that is the assessment. And understanding what may be the next step, or understanding that, and obviously prevention of that. Either you keep that drug away from you, go for the doctors for consultation, changing of the prescription, like that, and all that are related. That is the detection, assessment, understanding, and prevention is a science. That science is dealing with the subject known as pharmacovigilance. Means vigilance on pharmaco, means what derived from pharmacon or drug. Is it clear? Now, all of you have heard that the poisons are drugs in the small doses, but drugs are poisons on the larger doses. It is fact, because you have heard about the drug, that is the aconite. aconite is used in a small doses in the homeopath and in Ayurveda also. That is a plant-based product. But if you take it in a large scale, that will cause your death event by poisoning the effect, total effect. So poisons are drugs in small dose, but drugs are poisons on the large dose. It is that when you are taking any drug for your therapeutic purpose, obviously there may be the therapeutic effect of that, and extension of that therapy, that is the therapeutic effect, is known as toxicology. So obviously follow the doses rightly and take the guidance of the doctors and the pharmacist also related with the drug therapies and others. That is very important because all drugs are sometimes chemicals or plant materials or that may cause some good effect, but in the large doses they may cause the poisonous effect also. Now, the adverse drug reactions, any unintended, undesirable, or unexpected effect of a prescription medication that requires discontinuations of medication or modifying the dose, requires treatment with prescription medication, requires initials or prolongations of the hospitalizations, results in the disability or in the life-threatening stage, and results in death, results in congenital form. So all these are there, the adverse drug reaction, anything that is unintended. Doctors are giving unintentionally sometimes drugs or drugs that may cause anything about that is requiring the modifications or changing of the drugs, that is known as the adverse drug of the said drug, and so that should be changed. Otherwise, it will require hospitalization for 1 day, or prolonged hospitalization is required, or some treatments are also required due to your drug adverse reaction. Now, who has given the definition? World Health Organization. This is very important. Any noxious, unintended, undesired effect of a drug which occurs at the doses used for the prophylaxis, diagnosis, or therapy, excluding the therapeutic failures, intentional and accidental overdose, and drug abuse, and does not include adverse effect due to error in drug administration. If the drug is for oral route, if you take it in a water and want to take it the other route, means intravascular or others, obviously there may be toxicity. So obviously that is excluded from this definition. Otherwise, the thing is that noxious, unintended, undesirable effect of a drug which occurs at the doses used for the prophylaxis, diagnosis, or therapy purposes. Next thing is that why ADR? Why ADR is coming? Any drug can cause an ADR. Even the very simple drugs like your antibiotics, like your painkillers, anti-inflammatory drugs can produce ADR. All of you, the pharmacist, you can go through that details. Very operatively, multiple agents are administered, and occult antigen sometimes poses the major problem when we are using that thing, that is the latex, additive for preparing of the drugs, preparing of the tablet, or some things like that. That can also add your ADR system. So obviously, always follow what type of additives are used here for preparing a tablet. You know that 500 milligrams of the paracetamol is not only the 500 milligram, that is added with the some things that we are calling that inert excipient, but not all the excipients are inert in their natures. They can also cause some adverse drug reaction. So very careful about taking of the drug. Always try to consult your doctors and pharmacists, and always after that you can administer the drug for the safety of your family, safety of yourself and others also. And that is coming, the fatal areas leading to the death also. That is very dangerous things. That is also happening. And 5% adults are allergic to the 1% drug. And 30% medical impatients develop an ADS, advanced drug reactions, and 3% of all hospital admission are due to ADR. Actually, we are not getting these figures accurately because all the hospitals are not keeping the expert of the pharmacovigilance. So the reporting of the hospital admissions and ADRs are not reported properly. So very minimum numbers are they are showing. That is 3%, but I think it is more than 20%, and that is causing due to the multiple drug therapies and others miss your prescriptions. All that things are contributing factors for developing the ADS. Risks of all allergic reactions approximately 1 to 3% for most of the drugs. So these are the indications, and why ADRs, that for the ADR is required, you have to know what are the ADRs, and ADRs should be addressed very carefully, and this is the purview of the science that is known as the pharmacovigilance, because you have gone through some of the students who have gone through the phases like phase 1, phase 2, phase 3 clinical trial. After that, when getting a company's license, and that drug will come to the market, and that drug will be exposed to all the people, maybe the 90%, 80% of the people. So there may be the chances of ADS. So after that, the fourth stage of your phase trial is known as post-marketing surveillance, or in one way, it is pharmacovigilance. Now, severity of the adverse drug reaction. How we can calculate the severity? Minor. It is very minor, means no therapy is needed. Antidote or prolongations of hospitalization is required. Like if you are taking any painkillers, headaches or something like that, maybe that is a very simple drug, aspirin, that may cause some gastric irritations, even some the itching problems or something like that. So it is minor, no requirement of antidotes or something like that, or hospitalization. So that may be categorized in the form of the minors. And next will come the moderate, requires the change in the drug therapy, specific treatments, or prolongations of the hospital stay by at least 1 day. Now, the severe, potentially life-threatening, cause the permanent damage or require intensive medical treatment. That is dangerous. Severe is very dangerous. And obviously, last one, not the least, the lethal. You know the meaning of that. Directly or indirectly contribute to the death of the patient. So all these of the severity can be divided in that way, that the one is the minors, that the next one is the moderate type. Severe means that may cause to the intensive intensive care treatments, or ultimately, if it is not treated in the right now, so that may be cause the lethal effect of that. So that you will be very careful as a pharmacist about that, and obviously educate your patients, educate your hospital, educate other places that this is required. So giving any drug, prescribing any drug, that should be monitored in such a way that depending on the age, sex, others of the patient, the change of the medication is always required. Now, the pharmacovigilance is saying that the adverse drug event equal to ADR plus medication error. Any injury resulting from the medical intervention related to a drug in order to encompass harm that arise from the medication error, as well as conventional adverse drug reactions and medication error, is any preventable event that may cause or lead to the inappropriate medication use or the patient harm, while the medication is the control of the healthcare professionals, patients, or consumer. Means if a doctor is prescribing you in such a way that warfarin is given, and along with that warfarin, the patient also given as a blood thinner agents, that is the aspirin, both are causing the interactions between these drugs, and that may cause even death also be due to the huge bleeding inside of that. So that you will be very careful about that, and doctors should be known about that. If the doctor is prescribing in that way, you should talk about the drugs interactions and obviously go to the doctors for changing of the prescription. Otherwise, patient will get in trouble and even death may occur due to these drug-drug interaction. So drug along with the other drug may cause some adverse effect, and so that should be avoided. Now, incidence of adverse drug reaction, I have already talked, that is around 5% of hospital admissions are attributed to the ADRs of patients taking average of the 5 to 10 drugs during 10 days stay in the hospital. And 25% develop the ADR. That is very big figures. And I have given the less figures, that is the 2.2 million. It is now reaching to, I think, that is a billion, because most of the time ADRs reporting are not proper, and most of the hospitals are not giving the proper ADRs effect of that. So the government of India already taken a decision that all hospitals, all nursing homes, all the medical equipment manufacturers should take that pharmacists as the pharmacovigilance experts, and they will go through the details of that. And obviously, the change of the idea, change of the prescription is also the duty of a pharmacist, experts in the pharmacovigilance that can change. I have seen it in European countries, in American countries. They are very cautious about the drug administrations or drug prescription. They even can cause the change of the prescription. That is the enormous power of a pharmacist. They are doing that things. But in near futures, I hope the pharmacists will do all that things on behalf of the medical association, on behalf of the pharmacy association. They will take account all that things, and obviously ADR will be lessened in futures like that, because only doctors are very busy. They are giving the drugs at a time, and that should go through a pharmacist who are knowing about the ADRs of that drugs, and he or she may change the drug prescription and again send to the doctor for rechecking of that. And you give the note also, that pharmacist will also give the note that this drug and this drug can cause the bleeding, this drug and this can cause cutaneous problems and others. So this is the duty of a pharmacist in the day of World Pharmacy Day. This is very, very important part of the pharmacy who will do in futures the expertise their knowledge in the pharmacovigilance. Because in near futures, you will see most of the job will come from that end, that is the reporting of the ADRs and the pharmacovigilance. And most of the hospitals will be bound to do or take the pharmacist as a pharmacovigilance expert to check all the patient's prescriptions and others and report in the proper way. Okay, I'll come to that point. All that things are theirs. So that is important. So there are the two types of adverse drug reactions. That is predictable or type A, which is known as the augmented reaction. Means the reaction is enhanced. Type of the reaction is based on the pharmacological properties of the drug, but qualitatively, normal response to the drugs include the side effects, toxic effects, and consequence of the drug withdrawal. What is? I'm giving you the example. If a patient is taking the aspirin, it is obvious, that is the predictable, that drug may cause some gastric irritation if it is taken in an empty stomach, and so that is that you can predict before taking, or your patient can predict what type of drug is taking, or any anti-inflammatory drug which are taken in an empty stomach that may cause the gastric irritations or something like that. So stopping of the drug, obviously, because the gastric irritation and others will go very quickly. So that is predictable. So this is known as the type 1 ADR system. And type 2, that is dangerous, that is called the unpredictable type, that is called Wizard's this type of effect is based on peculiarities of the patient and not on the drug's known action, including allergies, idiosyncrasy. They are less common, often acquired withdrawals of that drug. Means, if you are taking your drug aspirin or paracetamol, very simple drug, you can predict that this drug can cause some gastric. But if the drug is causing to some extent to the patient, very peculiar patient, that cause the anaphylactic shock or something like that, that means the patient is very sensitive to aspirin. That should be noted in his history or her history profiles, that aspirin should not be given that patient because that patient is very sensitive towards the intake of the aspirin. So these two are theirs, type 1 and type 2, and one is known as the Visa type, another one is the augmented type. All of you can understand this is very simple way I am taking the changes of that. So that is very important part, and I have given one the details about that you can go through the any pharmacy books. That is the type of effect, examples, and others. That is augmented, basics, chronic effect, delayed effect, end of the treatment. All are there. I am not going in details of that. You can get it into any pharmacological book and get the details of that. And apart from this one also, you can get the details about the internet and others also. Now, the history behind the ADR. It has been first detected 1880s. The chloroform was causing the cardiac arrest. So chloroform was discarded by using in the hospitals or in the clinics and others. In 1922, organoarsenal compounds causes the epidemic jaundice and fatal hepatic necrosis. So that compound was also withdrawn from the market. And streptomycin, you have heard, that is a very good antibiotic. In 1946, was reported with the deafness when streptomycin was given to the patient, and blast dysphagia in 1954 was reported with the chloramphenicals and thalidomide. All of you have heard that 1960, the thalidomide disaster was there in the Europe, which caused the pocomalia. I am stopping here to tell you about you where from actually the pharmacovigilance started. Now, when the thalidomide was first discovered in European country by the one famous company, and that was suggested for the pregnant lady who are going to the duties and others for their morning sickness. Morning sickness is very troublesome for a patient, that is the mothers who is carrying the babies and others. So the thalidomide was administered, and that was prescribed in a very huge ways in the European countries, and that was very successful drug. But after that, it was outbreak when all the babies come out in the world, and there was the deformities of the limb and hands, and that was like still type effect. I'm showing you the pictures. That is known as pocomalia, and that is known as monster formations like that. And 1970, Tacrolimus causes the oculomucocutaneous syndromes. In 1975, the clozapine also causing the granulocytopenias, cytosis like that. Triazolams in 1987, ofloxacin, and 1999, sildenafil citrate. Still that drug is in the market because of its side effect. That is actually the main effect now, and you can see the market value of this sildenafil. This was actually invented in the years, and that the side effect was invented later on, and which was used for the aphrodisiac effects or like that. And the 1993 to 1999, nimesulide, you have heard the name, painkiller, very good painkillers was in the market, which was your gastric friendlies, and national surveillance centers for ADS reporting say that it can cause fulminant hepatitis. So that drug was withdrawn in the name of the nimusulat, but you know that drug is still in the market, Indian market, and in the name of the NICE, N-I-A-C. You can ask for nimusulat, nobody will say no, that drug is banned. But the same drug in the other name is prevailing in the market. This is the picture of Indian pharmacy, and pharmacists are there. They are not giving their total concentrations on that. And ADS reported acute the hepatitis 2000 year of 2000. Tizapride was a very good drug which prolongs the QT intervals and causes the catastrophe points and tachycardia. I will talk to you about all these things in details about that one by one. So reactions for ADRs is over prescription, that is polypharmacy. If your patient or your family members are taking too many drugs at a time, that is the polypharmacy. It is very common terms to use, that is the polypharmacy, or self-medication, because most of the Bengali people are relying on the self-medication. They are not going to the doctors because most of the doctors are Bengali people. They can say that you are suffering from this disease and you take this one, that one, and even if you go to the medical shop, you can find out that drug OTC in the form of the OTC, over the counter, and that person is giving you drug. That may be he may be non-pharmacist, but giving the drug without thinking anything. But based on one thing that is very dangerous for you, don't give your certificate of pharmacy certificate to any medical shop. That if that shop is closed, obviously your registration should be cancelled, because they are doing all that things without knowing about the drugs action. They are based on your certificate. They are doing all that thing. Don't give for some amounts of the money. Don't give your certificate to use in that way. So obviously you do your research in future. You go for advanced drug reaction monitoring or pharmacovigilance job, but don't go to give that certificate to the pharmacy shop. They will misuse that pharmacy shop, getting for their license, and anything they can do without in your present, they will give the drug as a doctors. They are seeing their doctors, their pharmacists, and if anything is happening, the responsible person will be the pharmacist who have given that certificate. That is very dangerous things. So different viability of different drugs are very common, because in the form of the if you are prescribing, if your doctor is prescribing anything that is a drug, very common drug, paracetamol, you can get the different brand of the paracetamols in the market, Proceed, Calpol, etc., many more. But all the drugs are containing 500 milligrams of the paracetamol, but not all the drugs are releasing 500 milligram paracetamol in your the patient's body. So that is very dangerous. For that, the bioequivalence study are there for equivalence of the drugs with the standard drugs are always needed, and patient's physiological factors like age, sex, disease condition, that is hepatic or renal failures, are very important part, wherefore the drug will be metabolized, or the genetic predisposition, and obviously the last not the least one is the drug interaction, that is enzyme inductions and inhibitions of that are contributing factors for drugs adverse reaction. Now, if you categorize all the adverse drug reactions like that, so adverse drug effect can be categorized into the way that is the side effect, secondary effect, intolerance, idiosyncrasy, drug allergy, photosensitivity, drug dependency, withdrawal reactions, and all other things, the teratogenicities and others. So the one board has been formed, that is the government board, which are responsible for detecting the effect of the adverse drug reaction. This is known as the NCC-MER index for categorizing of the medical medicine errors. The blue is safety, no harm, and this one, the orange one, is known as the error, but no harm. Error is there, but error with the harm, this part, major part, and the grain you are seeing that this is error and lead to death also. So the pharmacovigilance students or pharmacovigilance experts who go through that, categorize all the disease conditions due to the drug, may categorize identify the drug in which category they are, and so that doctors should inform about that. Now the side effects. These are very common, unwanted, but often unavoidable pharmacodynamic effect that occurs at therapeutic dose. Atropine, you have taken the atropine drug for eye takings and others, and all of you have experience who have taken that atropine drop as the dryness of your mouth and others. That is the anti-secretory effect of the atropine. So that is acceptable. You know that the effect, so you go for that side effect for the few minutes or hours. That is okay. And secondary effect is that these are indirect sequence of a primary action of the drug. So suppressions of the bacterial flora, that is the good bacteria in your systems, that is that tetracycline can cause the eradications of that good bacteria, cause the super infections and others, and so, and the corticosteroid, most of the time doctors are giving the drugs for acute case of the asthma and others. They are giving the steroid in the different doses. Obviously, they start with the low dose to high dose, and also the lower the dose in the tapered way. Corticosteroid, mostly used by the doctors, that can cause the hampers, the host defense mechanism, and that can cause your secondary infections like that. So after tetracycline infection, doctors are prescribing one drug known as Leviate or live yeast, which can again deform the good bacterial flora in your stomach, and that can cause the digestion power, increase your digestion power also. Now the intolerance, it is the appearance of the characteristics toxic effect of the drugs in an individual and therapeutic dose. So single dose of diflucomazine cause muscular dystonia in some individuals, especially in the children. So the doctors should be very cautious about prescribing these drugs to children, which may cause the muscular dystonia, and sometimes it may cause the permanent paralysis also. So that are caused intolerance by the patients of the younger age, and this is idiosyncrasy. This is not happening always, but sometimes even the very simple antibiotics can cause this type of disorders. You are seeing these pictures. That is the redness all over the face, and it is the abnormal reactivity to a chemicals. That is the drug interactions with some unique features to the individual, not found in the majority of the subject, and produce the uncharacteristic reaction. It is not happening to all patients, but sometimes it is happening due to a single dose of any antibiotic, any painkiller, something like that, or any cream you are using in the face, mainly coming from the different companies. They are advising that this cream is very good for your skin, these fairness creams, etc., etc. No cream in the market available which can give you the fairness. So always avoid about that things. Otherwise, this may cause this type of idiosyncratic reactions like that. And drug allergy, that is very common, and immunological factors mediated reaction and stereotype symptoms which are unrelated to the pharmacodynamic profiles of the drugs, and allergic reaction will not occur on the first exposures to the substance. The first exposure allows the body to create antibodies and memory lymphocyte cells for the antigen. Is it clear? I am giving you the clarification. The first time the allergy-prone person run across is the allergen such as the ragout. Ragout is a wheat which are found in the American field and others. If anybody is cutting its grass and something like that, attacking with that, he or she makes a large amount of the ragged Ig in their body. As an antibody, these Ig molecules attach themselves to the mast cell. Mast cell is profoundly found in the lung cell. So once it is attached to the mast cell, the second time the person has a brush with the ragged, the IgE prime mast cell will release the powerful chemicals known as your protease, your some things like that. All that will come at a time, and that person will suffer with the huge wheezing sounds and sneezing of theirs, watery eyes, etc. So that is known as the allergy. Allergy, once you are exposed to small amount of the allergen, and in future, if you are attacked to the same allergen, you will cause that. And in the long run, if it is going on, so there may be the chances of production of your lung infections with the asthma and COPD, chronic obstructive pulmonary disorders like that. So always be aware of that, which drugs you are allergic, or which environment you are allergic. So that is very important. Change of place is always not possible. So always you conceal your mouth and nose by the mask, and avoid that type of the allergy producing substances in the ears. That is the only way that you can do. Or in the prior of that exposure to that, you can take that the allergy take away from the allergy producing substances by taking some medications such as there's mast cell stabilizers in the market. Prior to that, in winter seasons, in the rainy seasons, most of the allergic persons are attacked to the substances in the environment that may cause the allergy, and even that can lead to the asthma attack to a person who is allergic to the substances like that. Now, photosensitivity. Some drugs are causing the cutaneous reaction resulting from the drug-induced sensitizations of the skins to the UV radiations. Photosensitive drug reaction, secondaries to the medications, may causes the phototoxic, photoallergic, and lichenoids reactions to the persons who are allergic to the substances. Like I am giving you example like that. The norfloxacin is a drug for very simple bacterial infections and others. Sometimes some body take. If taking the norfloxacin in the morning time, you go out in the and exposed to the UV, there may be the chances of redness of the skin and others, and that is known as the photosensitivity reactions of the drug. Now, drug dependency, all of you have heard, that is the which can alter the mood and feelings, and liable to repetitive euphorias, withdrawals from the realities, social adjustment, and it's a state in which use of the drug for personal satisfaction is according to the higher priority than other basic needs of a risk of the health. Like your first, you have heard that is the heroin. Heroin was first introduced into the market by the company as a painkiller, obviously painkiller, but the people who were using that thing feel euphoric, means good feelings, and so repeated use of that may cause the physical dependency of that, and that is called the drug dependency. That is very dangerous. That is the dangerous pictures of a society. The most of the young people are prone to the drug dependency like that, and that is addictive in nature and cause euphoric in initial stage, but in the long run there may be some problems, the heart attack and some things like that. So always about all that about drugs in futures. If you see anybody is taking that thing known as the puria or something like that, so always about that thing. And if other is taking that thing, you just hinders that body from taking all that. Maximum in the hostels, in the groups, most of the people are doing all that social abusing. So these drugs are known as the social abusing drugs. Now, withdrawal reaction, because these type of drugs once withdrawn from the system, so there may be the changes of the physical activity, like watering of the tears and others. So all that things are very important factors. So, and you know that severe hypertension, restlessness, and sympathetic overreactivity may occur after discontinuation of the clonidine. So, any drugs which may causes the withdrawal reaction should not be withdrawn suddenly, like your steroid, that should not be withdrawn suddenly because that may cause the withdrawal reaction. So all that drug is withdrawn from the system by in the tapering way, by reducing the dose, by the day by day the dose will be reduced, and after that in a minute dose that will be reduced, that will be withdrawn so that there will be no withdrawal reaction. Otherwise, if suddenly withdrawn from that drug, there may be the huge chances of withdrawal symptoms like that. Now, what I have said earlier, that is the teratogenicity or phocomelia. This is the pictures of phocomelias, and you can see this phocomelia causing the seal-like effect of your organs, like mainly your hands and legs, and obviously the brain formation is also hindered. That is referred to the capacity of the drug to causes the fetal abnormalities. When administered to a pregnant lady, thalidomide was given to the pregnant ladies for curing the morning sickness. But after 9 months, it found that most of the babies come to the world, so they were all the phocomelic in nature. That is the known as the teratogenicity. Means teratos means teratogenicity test on the pregnant rat and found that whether that has any effect on the fetus or something like that. So after that only, the company will be given the permissions for marketing of the drug. So this is very important part of your study, that is the teratogenicity and monster formation by drugs. And you can see when that is happening, the fetus in the 3 stages may be the teratogenic possibilities, fertilizations and implantations, the conception of 17 days, organogenesis in 18 to 55 days of the gestation, and growth and development 56 days onward. So between these 3 stages, anytime that mother is taking that drug, and you know that the placental barrier is very porous for all the drugs to the fetus, and that may causes the placental barrier easily, and that may causes this type of teratogenic effect. So always take some necessary actions regarding that teratogenicity test should be there when any toxicity study is conducted in the laboratories for further upgradement for the human study or clinical trial. Now, here is the teratogenic drugs are there. Many more drugs were after that. Thalidomide was included in the list, so you can go through that in the internet and others. I am not going to too much of that. The drug which are teratogenic in nature, that drug should go out of the drug market. Now, this is very important part. That is, what is HERG channel? Have you heard the name? I think most of you have not heard this name or may heard. That is known as human ethers, a go-go related gene product is a potassium channel that plays a vital role in repolarizations of the cardiac action potential. What is cardiac action potential? Only when any electric current or electric impulse is coming to the heart cell, there may be the changes of the action potential. What is action potential? The sodium will try to enter into the cell, and it will replace the calcium and potassium out of the cell. So this is action potential, so known as depolarization. After that, after a few seconds, the sodium which entered will go out again, and there may be the chances of quick chances of calcium entry in the plateau levels and late entry of potassium. So distance between these two, have you seen? I don't know whether you have seen the graph papers of that used for ECG. You can see some pictures like that, all are representing these cardiac polarization, depolarizations, etc. Known as PQRST. P start Q. This point is Q, going very sharply. Then R is coming. PQR is here when your potassium is entering into the cell, so that cell will be normal. Otherwise, if any delay in entering of the potassium through that HERG channel, that can causes the problems, real problems with cardiac arrhythmias, and patient may die also. It has been found that some drugs were in the market which were causing the channel blocking of the HERG channels. So late entry of potassium was restricted and causing the arrhythmias or something like that, even death also. Now, the Drug Control Authority of India and USA FDA, they have identified some drugs in that way, that these are some drugs, sulfonidines, estamazole, suzapride, etc., drugs were withdrawn from the market, because of they have their capacity to prolong the QT time. Means from Q to T, the time is only 0.2 millisecond. If it is above of that, so there may be the chances of arrhythmia formation. So all that drugs are now 100 of drugs are listed. That should be deleted from the list of the drugs in the world market. So this test also has been referred as the drugs which are causing the HERG channel blockers, and that channel blockers drugs are dangerous, which may cause the arrhythmia. If the drug is for the other purpose, means painkillers, like rofecoxib, when came to the market, huge market was there because it was not touching your mucous membranes of stomachs, but that was causing the HERG channel blockers and causing to some patient with the heart attacks and something. After that, it was found that this was causing the QT time prolongations, and after that, the drug was withdrawn from the market and huge compensation was given to the patient who used that drug. So this is there. So drug research is not a very simple way, or monitoring the drugs, adverse drug reactions are very important part. Minority that all the drugs should be under the scanner of the pharmacist and doctors also, that the drug which are not causing to the mothers or fetus bearing mothers or causing the heart with the HERG channels blockers, all that things are there. QT time prolongation. Now in the 100 types of the drugs in waiting in the line for cancellation or withdrawals from the market, only due to these factors, that is HERG channel blockers or late entry of the potassium due to that drug administration. This is very important part of your pharmacology, something, whatever may be the subject, you go through this one in details. I'm giving you the only in short, and found that these drugs are very dangerous for your system. Now, all of you are, most of the herbal markets are flooded with some drugs. You don't have any way to check the quality of the drugs or something like that, because most of the time the manufacturers are claiming that all the drugs are in the market herbal origin, they are safe. It is not safe, because some drugs are also causing hepatotoxic, cardiovascular system, cardiovascular, hepatocarcinoma, carcinogenic, and hepatic, nephrotic, and all that sodium and water retention, that is licorice. So always go through the details about that, what type of herbal drugs instead of the modern drugs you are taking, that if anything is causing any good effect, like your drug, that will also carry some bad effect also. Even, water is essential for our body. If you are thirsty, you take one glass of water. If you are not satisfied, then you take another glass of water. But if you take one cup full of water, your kidney system will be abruptly fast or abruptly stop its work. So that is the thing, in what amount you are taking your drug and in what amount the pharmacodynamic effect will cause the toxic effect. That is very dangerous things. That is also the purview of a pharmacovigilance expert. Now, you see, some very simple drugs, alprazolam, is used in USA and other countries also for reducing the tension. Alprazolam easily available, and this is the drug which are known as the OTC product. But alprazolam can also induce some effects on the pulmonary arrhythmias and others. So that drug, that is a very simple drug, is causing this type of effect. So no drug is, apart from the toxic effect, it depends on the person to person or the time to time, age to age. All factors are there which are the contributing factors or genetic factors which are contributing to toxic effect. So drug always should be treated as a drug or a medicine. It is not that you are taking the drug as the homeopathic globules and it has no effect, it has no good effect, or it has no bad effect. So it is not that. Even in a milligram dose, 1 milligram, 2 milligram dose, that drug can cause a toxic effect like that, adverse effect like that, heart failures like that, kidney failure like that. All that should be considered when a patient is taking any drug, and all that factors should be considered by a pharmacist, by a doctor, by a nurse, the which prescription that a patient is following, and which of the drugs are under the scanner of the pharmacovigilance, and that should be noted very carefully. Like another amoxicillin, very simple antibiotics. For most of the time, we are prescribing these drugs within our family, within our friends and others. They are the friends and others are going to the market, getting that things without any question by the person who is selling the drug in the pharmacy shop. That may cause also erythema and the eruptions of the whole body system, even the legs and others. So you never consider a drug is a very safe, because most of the drugs are only taken during the period known as the when it is required, and by the supervision of the doctors is very essential, or by the supervision of a pharmacy is essential, and even the scanner of the pharmacovigilance expert. Now, this is also another example, that is the dextromethasone. You have heard the name of that as the steroids-induced allergy. Sometimes that steroid, most of the times, are used for skin cares or skin diseases, are causing the skin disease like that. This is called allergy induced by steroids. It's very common part of that, and heparin-induced bleeding, which heparin is known as the blood thinners, sometimes taken from the venous blood or returning in a quick way. That may cause the continuous adding of that, or at the site of the injection, there may be some bleeding tendency. So heparin-induced bleeding is very common. So when giving the drug in the intramuscular intravenous something, whatever may be the route of the administration, that should be taken into account, that the drug should be taken in a very cautious way. Now, this is the place where most of the report, that is the adverse drug reports, are ultimately coming. That is Uppsala Monitoring Center of Sweden. And that monitoring system is monitoring on the total adverse drug reaction report, and they take their own that whether the drug will persist in the market or that will be withdrawn from the market. That is very important. So this center, all are member of this center, representing that countries, and they are assembled there for discussing that drugs prevailing in that countries or in other country also. They will take their decision that what type of drugs are prevailing in the market, what type of drug will be withdrawn from the market. All is very important part of that centers. And nowadays, India government is making different centers of pharmacovigilance centers in north, in west, in south, in east, etc. And in hospitals, in your nursing homes, in other places also. So anybody can take the responsibility of the drug monitoring system and take the charges of reporting against that. I am telling you that thing. So summary, if you go for the summary, you will be sure about that any drug can produce some form of ADR. Even simple drug like aspirin, the paracetamol, and most of the patients without asking anybody taking paracetamol or any sleep-producing drug, the diazepam, something like that, that will cause ADR. Significant harm towards risk cost and increased hospital stay associated with ADR. Allergy, atopy, or asthma patients have been suggested to be at an increased risk. Antibiotics, blood products, drug preservative, that sulfates and methyl parabens are used for making drug tables, or polypeptides, that is the latex or something like that, are added to the drug for giving a drug shape or drug delivery system, changing of the drug delivery system. We are frequently doing that things in the form of that latex or something like that, may associate with the higher incidence of the reaction. Drug avoidance, whenever possible, is still the best method to avoid an ADR. Is it clear? I think now it is clear. You all persons are from the pharmacy. So ADR reporting forms, I'm showing you that suspected adverse drug reaction reporting form for voluntary reporting of the adverse drug reaction by healthcare professionals. ADR reporting form for consumer transfusion reaction reporting form, PHARMACOVIGILANCE, that is Hemovigilance Programs of India's, and medical device adverse event reports, that is called Vigilance Programs of India. All are there, but actually we are not using that thing, or we are not concerning that anything can turn to the adverse drug reaction to the patient. The normal patient, maybe not patient, only suffering from some headaches or something like that, taking the drugs without asking anybody. The pharma medicine shops are giving without any prescription, and that causes the adverse drug reaction. So be cautious about that. Don't give your certificate to any pharmacy shop when you are not presenting theirs. So, but you will be responsible for that. Now, patient, doctors, pharmacists, dentists can participate in the adverse drug reactions. And where to report? Nearest ADR's monitoring center. Here you can go to the articles. There are AMC, AIMS, Raipur's, patients of JNMC's, Raipur's, directly to the NCC, IPC, Ghaziabad. And here is the email IDs. Toll-free number is there. ADR reporting, Android apps are also available. You can, anybody can report. Yes, and so I am coming to the conclusion part, that through my short presentation, it is not a big time I got. So through this time, you can get some ideas of pharmacovigilance of ADRs. This is very important part for getting these things on the day, that is the World Pharmacist Day, where all the pharmacists get together for meeting together for taking all that decisions, that in your institute you can start also the pharmacovigilance centers. When I was at Jadavpur University, I started a centers known as the clinical research centers, where I started in the 11 years ago or 12 years ago, the pharmacovigilance study with the hospitals like your MRI. Now it is known as the municipal hospitals. They still are doing these things with the course and practical courses, and each and everybody who is coming to the pharmacy departments are inquiring about these centers, that where I can get the details about that, or I can get admissions to this course, pharmacovigilance course. This is very important. I am always again and again telling all the pharmacies to take at least part of that pharmacovigilance or take some certificate course or degree course or diploma course in pharmacovigilance so that in near future there will be no possibility of not getting a good job, because most of the foreign companies are pouring huge amount of the dollars in the market, and that dollar, if you convert in your salary, that is a huge thing. And most of the your IT companies are hiring now the pharmacies for monitoring all that toxic drug reactions and others. So it is a way that is opening in front of you where you can go for the good job. That is only thing I can say. It is not the good place for manufacturing, because the manufacturing companies are now buying the latest machines for making of the tablet. Most of the companies are now purchasing a machine which can give the coating of the tablets and others. So the space is now narrowed. You can go only the first thing in the pharmacovigilance. Now, thank you very much for listening to my lecture. Any question?
It is a really very pride moment for us to share a screen with Dr. Tapan Kumar Chatterjee, sir.
Yes.
Now I'd like to request our students, if anyone having any inquiry or you wanted to ask any question to sir, please raise your hand. From the student side, I wanted to ask if anyone having any inquiry or if you wanted to ask anything to sir, please raise your hand.
Please, somebody ask any question. We will feel proud for that.
Exactly. I'm ready to give you the answer.
Yes, Priyajit, you can ask.
Any question?
Priyajit, ask.
Unmute
yourself and ask.
If anybody feels that you will ask in the Bengali, you can ask me in the Bengali, no problem, I will give you the answer. But actually, your response will tell me that something you are realizing in the pharmacy on the day of 25th, that is the World Pharmacy Day. This is a unique day you have chosen for discussion, all that things in there. And near futures, I think you will go for the details about that, or set up the centers where you can get the fund from central government also, the pharmacovigilance centers also. So you can start the pharmacovigilance course also, short courses, and your department or your university or your institute can also earn some money. That is not the earning of the money, but the proper education can be given to the students who are interested about pharmacy degree with pharmacovigilance certification. I am giving you the guarantee that all of you will get the job in a good position. Is it clear?
Yes, sir.
Yes. So in near future, you will do that, right?
Yes, sir. I have a question.
Sure. What question you have? Just ask me. I am ready to give you the answer.
Sir, is there have any chance that ADR can be affected by age or gender?
No. It is not related to the age, gender, anything. You can do your course after finishing your M.Pharm also or B.Pharm also, but it is guaranteed that you will get your good job. It may not be in the West Bengal, but outside of that, but because in near futures, there may be the chances of thousands and thousands of the pharmacovigilance experts in near futures in different companies, different hospitals, different nursing home, etc. It will be mandatory for Indian scenario.
Sir, I am not talking about the course. I am talking about the adverse reaction effect.
Hey, all that under the courses, ADR.
No, is ADR affected by the age problematic or gender?
Obviously, I have said you that is the age is also factors, because the ages persons are with the impair the liver system and the kidney system. So passing of the drugs or going through the body, that is not very proper in case of the aged person. So there may be the chances of the toxicity. So in that case, the impaired kidneys or livers persons, the dose should be reduced and or that should be avoided. Is it clear?
Anybody else having any question?
So Biplab,
Yes, Vasis.
can I leave
Yes,
it?
Vasis, you may ask. Unmute yourself and ask the
Hello, sir.
question.
Hello.
Yes.
Yes, sir. I have a question that what you said about idiosyncrasy. It is about the individual.
No,
Idiosyncrasy.
actually, this is the peculiar activities of the individual, not all. One out of 1,000 people taking aspirin at a time, maybe there may be some idiosyncratic reaction in one person.
Okay. Sir, I have a question that is idiosyncrasy can be genetically?
Yes, genetically more things related with the genetically, because all the Negroes are genetically are very prone to quinine, anti-malarial drug. They are not tolerating that drug because of the idiosyncratic reactions are happening there because of the deficiency of 6-phosphate dehydrogenase enzyme. That is the cause of the idiosyncratic reaction. For that, no doctors is prescribing to the Negroes and others that type of quinine or anti-malarial drug. Clear?
Yes, sir. Thank you.
Anybody else having any question? Please ask.
Yes, Akash.
Sir, what
Yes.
sir, what is iatrogenic drug?
What is that?
Iatrogenic drug.
Just pronounce.
IATROGENIC.
Iatrogenic drug.
Citrogenic.
Just pronounce it.
IATROGENIC. Iatrogenic drugs.
Iatrogenic drug.
Yes, sir.
I think you are miscommunicated. Okay.
No.
Anyone?
I'm telling you.
Iatrogenic drug.
Iatrogenic means the cost by the medical professionals or medical treatments and can refer to the disease, complications or other harmful effects. The word comes from the Greek word that iatro means physician and genesis means origin. It is originated by a doctors. Doctors make disease. Sometimes doctors are giving the drug to the patient, causing the peculiarities like that. That is known as the iatrogenic disorder. Clear?
Yes, sir.
Okay.
That is iatrogenic disorder. No.
Disorder. No, the person who is responsible, that is doctor, iatrogenic
Hello.
person. So, Biplab, can I leave now? So, Professor Chakro, can I leave now?
Sir, hello.
Yes. Yes.
From today's discussion, let me interact with you about the 1961 thalidomide disaster.
Yes.
The drug was used for morning sickness.
Yes.
For the ladies, I mean, in the first trimester, the drug was withdrawn from the market.
Drug one initially withdrawn from the market, but again the drug has come to the market for treating other disorders like your leprosis, lepromatous leprosis. Very rarely used, but that drug again came to the market, and that to treat the disease known as the lepromatous leprosis, very rare type of leprosy. and only the drug available in that is the thalidomide. And do you know that thalidomide was the thalidomide is causing that disaster was checked by a pharmacist who, when he was checking the applications of that company, he was sitting in the FDA office of USA, and he denied their application because of when he visited the hospitals of European countries and found that fine tremorings in the end stage of the hands and legs, and they were using that thing. Only one point he rejected, that he told the government that I will give only the permission after 9 months. Means the end of the pregnancy. I will see the fate of that drug. Only after that I will give the permission. Where from this pharmacovigilance started? Is it clear?
Thank you, sir. And our Mr. Tapun Chakraborty, sir, once upon a time, with joined in Jadavpur University, he was with you.
Yes. I had a long
Let me
discussion.
give him a chance
I will always welcome Tapon for discussing the details about that. So today I am stopping because of you have other program also today. So I am stopping these things, and I have intentions to visit your place also physically. So that will be great things to me. And so now I am taking permission from you to leave.
So is it? Hello, sir. Hello. 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 Hello, sir. Am I audible?
I think sir has left the platform, sir.
Most probably.
I think sir has left most probably he left the platform as he got lots of other programs. So due to the lack of time, I think sir got left. Okay. Anyway, I wanted to introduce to our training and placement officer, Mr. Tapon Chakraborty, sir. Sir, could you please share some few words with our students?
Yes. So this is the auspicious day, the World Pharmacy Day. We have got the lecture, valuable lecture from the Dr. Tapan Kumar Chatterjee, eminent professor of Jadavpur University, now the Dean of JIS University, which actually ornamented in our knowledge in future. So I am again thanks to our respected chairman, sir, and with Dr. Prabhas Ghosh and Dr. Karunamay Bhattacharjee of our Gupsai Abhinandan Sangha for their entire work. We have smoothly conducted this webinar. I am giving my thanks to our principal, sir, Dr. Biplab Chakra, and our YC Nilanjan Adhikari and Mr. Somadip Singharai for their valuable service and the personnel adjustment, the whole program being smoothly done. Otherwise, it cannot be possible. My thanks to all of my fellow colleagues of PGIMS and the staff for their valuable service given to this webinar so that we have made the successfully. Thank you very much all.
Thank you so much, sir, for sharing such a wonderful things among with us. So we're gonna end up this thing over here. Thank you everyone.
Thank you.